I'm Dr. Ramneek Mahajan. I'm Senior Director of Orthopedics and Head of Joint Reconstruction at Max Super Speciality Hospital, Saket in New Delhi. The moment you hear the word arthritis and you start thinking, मेरे को कुछ हो गया, something has happened to me, but nothing has happened to you. Basically, your joints have an inflammation which is giving you pain, and this is arthritis. Some patients complain of crackling sounds, like frictions, like rubbing, and those are crackling, noisy knees, the creaky knees that you talk of. Somebody can talk of swellings in the knee. Somebody can cause some kind of burning around the knee joint. All of this are normal, common symptoms of arthritis in a joint. See, arthritis, as I said, is not a disease. Arthritis can be because of age, degeneration. That's degenerative arthritis, which is the most common cause of arthritis, also known as osteoarthritis. Then there is something called a gouty arthritis. That means arthritis because of gout, where your protein metabolism is hampered, your uric acid levels are high, and this is because of gout. Then comes rheumatoid arthritis, again an inflammatory cause of arthritis. Sometimes patients are moving around and they just have no rhyme and reason can be found why they got arthritis. Then it could be hereditary causes. Obesity is another contributory factor to your arthritis, not directly related, but yes, as a contributory factor. So all of these are actually the common causes of arthritis. See, they understand that there is no complication. Arthritis basically happens because of stages in which you have. So if you are in early arthritis, that means stage 1. And I'll probably limit this discussion to the most common area which gets arthritis, let's say the knee. So which is the most common early arthritis, wherein the patient has some pain on activity, some movements, some restriction, but then this can be managed with weight reduction. This can be managed with adjusting your footwear, doing some physiotherapy to keep your muscles active. Whenever you feel a discomfort, some pain, you can take a painkiller. So this is where early arthritis can take cover. Besides lifestyle modifications, you might use wedges, you might tell them to use some stick, you might give them some shoe raises, and all those things. They are still not comfortable, so you add intra-articular injections. These could be either steroids, these could be lubricants or hyaluronic acids or whatever, or PRPs. So these are the patients who would probably look at getting something more, but they are still on the conservative lines, where you push them to do physiotherapy, because then you want their muscles to remain active, the muscles to remain healthy, and before they actually worsen, you want to look at controlling and strengthening their muscles. As you move to stage 3, which is the late moderates, this is the time when patients have not improved with the earlier versions. These patients have a lot of restriction in their daily activities. The activities of daily living are affected, and then they need something more. After injections, you've tried some intra-articular therapies, they don't improve, they have some bowing, and you can look at one part of the knee being affected, and you can look at a partial knee replacements or unicompartmental arthroplasties. These patients benefit with alignment corrections also, so you can think of corrective osteotomies to straighten these bones which are bent. You can straighten them in this stage of arthritis. It's only when you enter the late stages, when all the daily activities are restricted, you don't feel like going to your office, every movement in bed, going to toilet, going to small parties, your extracurricular activities, everything gets cut down because of pain, restriction in movements, and that is the time when we say that you would need something more than that, and that could be either a partial knee replacement or a total knee replacement. So going forward, we are talking of stage 1 to stage 4 or early to late arthritis, and this is how the patient sequentially keep going down, and you have to find a right time to intervene to stop the further degeneration. That's what is how you manage these complications.